I will make a start anyway. So just to introduce ourselves and to firstly say hello and welcome to today's MSc Orthopaedics Open Day. Thank you so much for joining us. My name is Kate Thomas. I am the Events Officer for the Faculty of Medical Sciences here at UCL and your chair for today's event. We're hoping this session will address those course-specific questions you may have and will help you to gain an insight into our exciting MSc Orthopaedics program. I'm delighted to welcome today's speaker, Dr. Sujith Konan, who is here to address any questions you may have about our MSc program, and there will be plenty of opportunities for you to join in throughout today's event. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom or the chat function. If you're feeling brave, also we can promote you to a panelist and you can ask your question live if you prefer, so do let us know. So now to introduce our speaker, we have Dr. Sujith Konan. Dr. Konan is a consultant orthopedic surgeon with a special interest in hip and knee surgery. He is also an honorary associate professor at UCL. At UCL, he is also the program lead of the UCL MSc Orthopaedics program. Thank you so much, Dr. Konan. Now over to you.
Thank you very much. I hope you can all hear me loud and clear. Good evening from London, and wherever you're tuning in from, welcome to all of you. You just heard about me. I'm primarily a hip and knee surgeon. That's my main job, but in addition, I have several other roles, one of which is to lead this exciting MSc in orthopedics at UCL. So what I plan to do is tell you a few things about this MSc. I'll try and keep it brief. The idea is very much to get interactive and get you guys going, asking us questions. These events are useful so we can understand a bit more about what you want to hear from us. It's also useful for you to ask specific questions that may relate to yourselves. So I'll finish off in the first 20-25 minutes, and then you'll have plenty of time to ask your questions. I recommend you come live and ask questions. That will be always useful for us, but if not, use the chat boxes. So about this MSc, this is a master's program in orthopedics. Orthopedics, as we all know, deals with bone and joint problems. This is very much a higher degree, so it is not a bachelor's, it's the next level up. In the same breath, we tell you that this degree is all about teaching basics in orthopedics. So this program is slightly different to what you may have come across in other master's program, in that this is not aimed just at people who are going to practice orthopedic surgery, in that it is not aimed at doctors alone. So we have plenty of doctors applying for this who have special interest in orthopedics at different stages in their career, and we warmly welcome them. But we are also welcoming anyone and everyone who work in and around healthcare who have the common interest of orthopedics. So that's what we ask for. So to give you an example, our students typically are from various backgrounds of physiotherapy, occupational therapy, nursing lead sometimes, podiatry sometimes, and so on and so forth, just to name a few. So they could all be coming together. And the highlight is very much that you sit in the same classroom and learn the common topic of orthopedics. Now, we did this on purpose. So when we revamped the orthopedic program, we changed it to something like this, which involves several allied healthcare professionals, for the simple reason that today's hospital environment is about multiple different specialties working towards a common goal of getting our patients good results. So if you had that in mind, we wanted to translate that exact environment into a classroom environment. So we did not just want surgeons learning in one corner of the university and the nurses learning in another corner. We wanted them to come together and learn the same thing. This gets some people slightly worried and worked up in that they believe it's different levels of understanding of orthopedics, and when they come together, they don't do well. But I can reassure you that we've successfully run the program now for more than 3 years with this kind of model, and it works very well. In fact, the learning is much more enhanced when you work in a team with multiple different specialties together. This is definitely a taught program. So that's the first thing to understand. So we have taught classes. Typically, our classes are half a day, 3 times a week for a full term program. So it's usually Wednesday, Thursday, Fridays morning, half a day of taught lessons. We have some compulsory modules, which everyone has to take. We have 6 of them, different specialties of orthopedics, so upper limb, lower limb, trauma, research, pediatrics, spine. And then we have some optional modules. So again, we are aware that when you go back and put all this knowledge into practice, then you're very much dealing not just with orthopedics, but also with other things like perioperative medicine, research, for example, rehabilitation. So, excuse me, our students get to choose from several other optional modules. Apart from the 6 compulsory modules, they get to choose from several other optional modules around these perioperative medicine and so on and so forth, which are all run by experts as separate programs, but you get to sit in with them and you finish a small assessment at the end of that, and that completes that part of it. Most of those can be online learning as well, so it's not too busy in terms of how many classrooms you have to attend and so on and so forth. I think this program is very exciting because University College London itself is an amazing place to be. And then you get to be attached with University College London Hospital, which is a nice big building next to it, which is a busy tertiary center for orthopedics. And we take care of all sorts of complex situations dealing with upper limb, lower limb, trauma, hands, for example, pediatrics, and so on. Full stop. The reason that becomes exciting is then you interact every day with the lecturers you see, the teams that you work with. These are very senior people who work in these hospitals, so you get direct face-to-face interaction with them. And for those who are so inclined, you can then visit our physiotherapy department, for example, or our wards if you're a nurse, and see how they deal with things. So you're getting direct hands-on and face-to-face time with some really world-class people. So this becomes a big highlight of the program, although the master's is very much taught, and in the university, this becomes extremely crucial. We ask for some basic qualifications, and these are all on the website, but we need at least a second-class UK bachelor's degree or anything equivalent overseas. And so most people would qualify for that stage. And there is an English language requirement by UCL. You can take this up as full-time or part-time. So full-time will be 1 year, and your taught commitment, taught sessions are 3 times a week, half a day, typically Wednesday, Thursday, Friday mornings. You have to set aside some time for research as well. If you're going part-time, you can finish this over 2 years. So you have some more time. You take some of the modules in the first term and the other modules in the second term. There is a very enjoyable assessment at the end of it for everyone. And you know, it's usually been very constructive, and we've usually had very good results in terms of pass percentage and things like that. So that's the basis of the program. It's a very exciting one, and we find that usually students go away extremely happy with the program. Now, just to touch base on a few brief points, everyone asks, you know, what are we looking for in a candidate? So as I said, the common theme is orthopedics. So if your aim is to progress in orthopedics in whatever way you want to progress in orthopedics, you're welcome to join this program. I go through every application personally, and several other people do as well. But what I'm looking for is anyone who's enthusiastic enough to come and learn more about orthopedics, and more importantly, go away and apply that knowledge or information in their own practice. So if you can demonstrate that in your application form, then you're more than likely to be selected and be part of this MSc. What students find useful about this program is the other common question we're often asked. So as I said, the work environment is great. So being right next to a big tertiary hospital and interacting with people there. Most of your lecturers are surgeons, so in direct interaction with surgeons, and the kind of topics you read around anatomy, around procedures, and so on and so forth. These are all fascinating, even for people who may not then go on and do operations or know about those operations. But when they go and apply that knowledge in their day-to-day practice, they find it very fascinating. This is a level of knowledge that you get, which is slightly beyond any of the bachelor's program that you would be used to. The other big highlight, and I say big highlight, because research becomes extremely important. It is a compulsory module. Everyone finishes a thesis and submits a dissertation, which in itself is an excellent experience. It's a lot of training. It's a lot of experience you gain on how to formulate a research question, how to do literature search, basics of statistics, how you could then comprehend all that and come up with a flowing thesis that other people can understand, and then submitting that to deadlines, so working to deadlines. A lot of experience to be learned from the research. The research topics are typically chosen for the candidate. For example, the surgeons are given topics which would be useful for them in future life. If you are a physiotherapist, then we try and align your topics in that direction. So again, something that can be useful. And we are very proud of the fact that most of them are clinical research. So you don't necessarily go to a lab and spend a lot of time doing basic science research. Instead, you do clinical research, which can be applied to practice, often which can be translated to your practice later on. And most importantly, we try and get them all published. So any candidate who wishes to get their research topic published will get it published by the end of the MSc, if not a year later. So we've had some very successful high-end journal publications coming out of this MSc, and we're very proud of it. So that is often a bonus on your CV when you can say you completed an MSc and have got a publication out of it, if not more than one. Career progression is something we get asked about a lot. So how this is going to help you in your career. I'm not a career counselor, so I can't give you all that information on career counseling. But I can tell you this, that if your common aim is to progress in the field of orthopedics, and you come here and finish this master's program and go away with a successful master's title on your CV, and have the knowledge that you get from this master's, both clinical and research wise, then I have no doubt that a degree from UCL will take you much further than in your career than you would have dreamt of, and that's all I'll say. But there are other separate career counseling opportunities that UCL offers, and those who are interested should attend some of those webinars and lectures. Ultimately, I think the biggest highlight of this is that we are right in the middle of town. So if you look up the middle of the world, you find London. If you look at the middle of London, you find Houston, and that's where we are. So I think one of the biggest highlights of this is the culture that this whole thing brings with it, and the fact that you get to live in London, spend that year in London, make great friends here, and some wonderful experience, which you will never forget for the rest of your life. So that's, for me, that would be the biggest highlight. Why you should come to UCL, why you should do a master's program in orthopedics in UCL. I'm going to stop there. I think I've covered a lot of ground. It'll be good to come back to whoever was listening and get some questions, take some questions, or even discuss a few things in more detail if you thought I went too quickly there.
Thank you so much, Sujith, and actually you gave a really good, thorough overview of actually what the program entails. I can't see any questions at the moment, but I will kickstart with a question I received prior to the event. So just a little bit about any advice you may have for a prospective student looking to fulfill an application? Do you have any tips for what they should include in a personal statement, or what really kind of grabs your attention?
Yeah, so that's a very good question. And I didn't cover that in too much detail, apart from saying that orthopedics is a common theme. So when I look at the application, there is a very fixed way I look at it. I always look at the personal statement first. For me, this is all about why you want to be there. Why do you want to do a master's program? And if it's simply because you want a master's on your CV, then it's less attractive than some other details, such as how you're inclined to further your knowledge, how a personal experience has helped you, shape your career or think towards orthopedics, or how you think that you heard about these master's programs and how other people have done successfully, and you want to follow that same model. We've had some amazing reasons why people want to do it. We've had people tell us that there's not enough orthopedics being practiced in their country, for example. Remember, we get applications from all parts of the world, and some of those are really humbling to read as to how we can promote knowledge around the world, because we are so used to big cities and a lot of opportunities. But a lot of people who come and do this MSc then take that knowledge back to their own countries and use that in a very successful way. Once I've seen the personal side of things, I always make sure that the candidate would not regret coming and doing an MSc. So that's very important for me. So I always look at what they've done beforehand. And I'm not looking at whether they're doctors or not. That is least important to me. But whether I see that it would definitely benefit them as well. So if the candidate feels it benefits them, that's one thing. But if I'm also convinced that, yes, this is going to help them, and there are occasions where we tell, people that they may want to consider some of the other MScs that run in UCL. So we try to do that to some extent. Of course, we don't try to interfere with your choice or your selection, but sometimes it's also important for us to believe that this is going to, from your background, that this is going to make a big difference to you. We don't want people to take up this MSc as a career changing option and then regret later on. But and there are lots of MScs at UCL, so sometimes we can direct you. Once you've done that, then I look at your CV. But again, a CV can be structured similarly for lots of people, so becomes less and less attractive. So if you were to really focus on your application, look at the personal statement, make sure you demonstrate that this is going to actually help you progress in your career, and then we're definitely more than welcome to have you here.
Fantastic. And obviously an enthusiastic application is always key as well. Having that kind of enthusiasm for the subject is always quite an important factor. So we have actually got one of our attendees that's raised a hand. Okay. So I'll promote them so they can actually speak and ask their question directly to you. So hopefully they should be able to pop up shortly.
Hello.
Hello. Hello, Sujith.
Good evening.
Please let us know what your question is. We're delighted to have you.
So I actually have a couple of questions. So just a very brief introduction about myself. I just recently graduated from my MBBS in May of 2022. So I was thinking of applying for a master's either in musculoskeletal sciences or in orthopedics. So that was my first question. How does the scope differ between the two? Because on first sight, they're pretty similar. So is there any difference in particular, or are they pretty much the same, or in what direction do both courses go towards?
Did you say you have two questions, or you want me to answer this one?
Yeah, I can go ahead with the second question as well.
Yeah, please give me both your questions so I can then answer both at the same time.
Yeah, so the second one is not exactly pertaining to the course, but before the session, I kind of just did a quick search on, you and the other lecturers of the course. And, one thing that struck to me was that you also deal with sports injuries and, surgeries for that, which is something that I'm aspiring to do. So is there any particular order of qualifications or a particular pathway you would suggest towards attaining that goal, or is it just based on my personal preference, or are there certain things that I have to do, certain things that I can do if I wish to?
Yeah, so all excellent questions, and it's good to get these out of the way. So yes, the UCL has a musculoskeletal MSc and an orthopedic MSc. I can't speak for the musculoskeletal MSc, but I'll tell you what orthopedic MSc is all about. It's as I said, it's all about clinical orthopedics. So if you're a clinician, you definitely want to think about this one. And we've had candidates being sent across from other MSCs because they are clinical candidates, and we are the clinical MSc. There's a lot of basic science research the other MSc does, but again, I can't fully speak for them, and I don't want to be quoted wrongly. But as a clinical MSc, if your aim is to gain clinical knowledge, if your aim is to be taught by clinicians, if your aim is to have access to departments which are orthopedics, right, based, then this is very much the MSc to come to. Okay, so we deal with clinical orthopedics. So that's your first question. Very simple answer. As an MBBS graduate, you should be thinking of this MSc. The second question is quite interesting. So it depends on, may I ask you where you finished your MBBS? Where was the MBBS from?
So I studied in Ramaya Medical College in Bangalore.
From Bangalore in India?
Yeah.
So the career path in UK, I can tell you about, which is what I'm aware of. We are orthopedic surgeons. We are surgeons first, then we become orthopedic surgeons, then we become specialists. Okay. So when we become specialists, we then it's decided for us what kind of procedures we do, and then we can also then say, okay, I won't do XYZ procedure, I'll just do so-and-so procedures. But we are in UK, we are joint-based surgeons. So we are, for example, I'm a hip and knee surgeon. I focus on the hip joint, the knee joint, and the bone in between, nothing else. That's all I focus on. And I deal with all kinds of injuries and problems with those two joints and the bone. And I deal with all kinds of sports, wear and tear, arthritis, any problem to deal with those. That's the UK model. Some parts of the world, like US model, is procedure-based surgeons. So people would just do replacements or just do sports. So that would depend on where you end up progressing your career. Now, the older model used to be orthopedic surgeons do everything. That's kind of died out already in most places because patients don't want that. They want specialists. And plus, if you are in a busy practice, it's very difficult to keep up doing so much of work. So you're better off doing focus work on what you really get good at the end of it. So the way to become a sports surgeon in the UK for sure is to choose which joint you want to do and then do all the procedures to do with that joint. Most of sports injuries are non-surgically managed. So it's only a small percentage that requires surgery, and they come to us. The sports physicians take care of, tear in the muscle, which they rest and rehab and things like that. So that's a different career path. When you can be a sports physician here in UK, but you won't be a surgeon. So there's a lot of variation in practice, but I wouldn't see a condition that needs to be managed without surgery, for example. And the sports physician, if he sees a condition that needs surgery, they would send it to me. So we kind of are at a, I don't want to say higher level, but at a different stage in that we don't even get to see some of the basic referrals. What we see is what we absorb from all the other primary referrers who then send it to secondary care, and we see the tertiary aspect of it. But then it'll ultimately depend on where you end up and what kind of speciality you choose and so on and so forth. I hope that answers your questions.
Yeah, thank you very much.
Fantastic. Thank you so much, Sujith. And we do actually have another question from Thomas Pollinard. So this question is, when the program says 1 full calendar year, does that mean the full 365 days? And when would I expect to finish the program, the full-time program?
So yeah, no, excellent question. The short answer is yes. This is if you're taking up a full-time course, this is a full-time commitment. I suspect the question is, are you taught every day, 365 days? The answer is no, because this is a master's program. A lot of it is self-directed learning. The taught part of the course is on 3 days, usually in my program, typically Wednesdays, Thursdays, and Friday mornings, when you have taught lectures, where you will have enough to go away and revise. You'll have to spend some time doing research. People spend some time observing in hospitals and so on. So if you're taking up a full-time 1-year course, then this is a 1-year commitment. So you are almost committing to doing that the whole year. There are people who very successfully manage to also do some jobs on the side, because we are very well aware that there are practical scenarios which require that to be done. So if you can't commit to the 1 year, then we have the part-time option, where you only do lectures on 2 days, and you only finish 3 of the modules in the first year and 3 modules in the second year. So you can kind of split it up if you need a bit more time, and a lot of people find that much more beneficial, because you finish your degree in 2 years, and that's good. So Paula, did you say, if you look up on UCL website, every year they'll publish the term dates, which is pretty much standard for UK universities. So they'll tell you when the first term starts and finishes, when the second term starts and finishes, and so on. But typically it's end of September start, and you should expect your results and completion by end of September the next year if you're on a full-term program. Hope that answers all aspects of that question.
Thank you, Sujith, for the answer. And also, Thomas, if there are any other questions you have, if we haven't addressed everything you wanted, please feel free to just pop that in the chat as well. I do have another question, actually, Sujith, just so we can get an idea of the numbers on the program. Do you know what size the tutorial groups are?
Yeah, so we are a very specialized program, in that orthopedics is a very specialized bit of medicine as such. So in terms of numbers, in terms of student numbers, we're typically running at around 10-12 students a year. And remember, they're selected from all over the world, so it's not a big program. You're not like sat in a classroom of 100 people and not getting any attention. Our lecturers, so right now we have, in addition to me program leading, we have module leads for each of the modules. So that's 5 module leads, and I look after the research module. And each module lead then uses anywhere between 10 to 12 lecturers to teach you. In addition, we have admin staff who help you look after admin side of things. And then, of course, various departments in UCL integrate with us when it comes to various other things. So all in all, a big team. So you'll feel part of a big team, but your student groups are usually nice and cozy, and everyone gets good attention.
Fantastic. And I don't know if you know off the top of your head, but in terms of the split, do you know roughly the split between kind of self-directed study, tutor groups, and the lectures, and what that kind of would look like in terms of
realistic
a week?
Yeah, exactly. So everyone has a different way of learning, isn't it? So that's very difficult to summarize or to put a number on. But I would expect that most candidates would have to spend 3 half days a week on the lectures during the term days. Of course, you get your term breaks in between, and then you're probably spending a full day at self-directed learning, preparing for them, and then coming back and revising them afterwards, that kind of thing. And then the research module will probably take up probably 1 or 2 hours a day if you were to split it up for the whole year. Our lectures usually run term 1 and term 2, so you still have term 3 reasonably free for revisions and finishing up your thesis and so on and so forth. So that's the general way I've seen students work at it. We had students who finished the whole thing in 1 term, and then just attend the lectures and they're ready to give their exams. We've had students who take until the last day to prepare and so on and so forth, but that's individual preference.
Fantastic. Thank you, Sujith. And I can see that we haven't got any other questions at the moment, but as we have got a small group of you together, it'd be quite interesting for us to know a little bit more about you and perhaps potentially your backgrounds. So if you're happy to share that with us, either by raising your hand or by popping in the chat, hopefully then Sujith can have a little bit of, be able to give you a little bit more guidance, potentially being a little bit more specific to you as well. That would be really beneficial for us. So I don't know if, for instance, if you've just completed MBBS or so forth, or if you're not, if you're from a completely different background, do just let us know. That would be fantastic for us to hear from you, and to try and make this event obviously as engaging as possible. That would be great. But yeah, I do actually have another question, Sujith. If it's mainly a bit about, obviously, I know that we were saying that it's quite a full-on course. Do you know what the mixture of assessment methods are, and which ones you kind of implement throughout the program?
Yeah, so I think assessments are the easiest bit, I think, right? Because usually with these master's program, if you've attended your lectures, a lot of information is already on something called Moodle. UCL uses Moodle. So most of the information is there. And most of the questions are based on the lectures that are provided. For example, if a particular year, a particular lecture has not been given for any reason in a satisfactory way, then the questions are not phrased from that particular lecture. So I believe the assessments are the easier bit. The more challenging bit is to make up your mind, apply for the MSc, go through the MSc and complete it. So that becomes a more challenging bit. But everyone worries about assessment, but I'll put it out there that's perhaps the easier one. So we have used several methods, not because we wanted to, but because we had COVID in between. So we adapted lots of different methods. Currently, our method of assessment is simple MCQs, which everyone's used to in medicine and nursing. And sometimes we use something called extended matching questions, which are a kind of variation of MCQs, which tests your knowledge slightly more. We don't do negative marking, so everyone answers every question. Passing percentage is extremely straightforward, 50% is pass. We do mock exams at the end of term 1 and term 2, so everyone gets a feel for what the assessment is going to be like. Some people get thrown into panic mode after that. Some people feel delighted and chill out after the mock exam because they know they're doing fine, but it prepares you. So you have 2 mock exams, and at the end of that, end of term 3, with a lot of notice, you take your assessments. It's usually an online process right now, so you do it on a computer, straightforward, tick the right answer, no negative marking, go to the next answer, that kind of thing. The vivas are conducted after the MCQ exams. The viva is the easiest bit because it's based on your research. So you'll have me and one external examiner, 1 or 2 other people sat there assessing you. But I can tell you this now, we know very little about what you've done, and you know very much about what you've done. So viva is the easiest bit for candidates. It's an opportunity for you to shine. It's an opportunity for you to actually get lots of marks and points, and that the best viva and the second best viva get selected for the Dean's Prize, and so on and so forth. So I think for those who are looking for a challenge, the vivas are the day for them. And as I said, the assessment of the other modules is fairly straightforward.
Great, thank you so much. It's always quite helpful to have that overview, because I know assessments can seem quite daunting. So that's very reassuring to know that there's like good balance as well. So
yeah, and I should also put it out there that we've rarely had someone not clear the MSc.
Okay, great. We do actually have another question. So the question is, how important is prior research in an application? Because it's Sujith again, because in my case, I didn't really pursue on during MBBS.
Well, prior research is not important, no? I mean, part of the reason we have programs like Masters is to give people that opening into research. So I would say not at all important. And to that end, I'll answer the other end of the question. UCL has several resources for those who have never done research before to understand research methodology, statistics, systematic reviews and how to write them, meta-analysis and how to do them. There is a UCL statistics department. There used to be a walk-in service. I don't want to promise, but there used to be a walk-in service 1 day a week where you could walk in and take your particular statistics to them, and they would guide you on what you could do and what you couldn't do. UCL also automatically gives you access to programs such as SPSS and EndNote through their website, which again helps you with writing your thesis. And these are all great tools that if you use once, you will use for the rest of your life. So that's a lot of hidden learning in all those things. So I am not looking for someone who's done a lot of research, no.
Okay, great. Hopefully that answered the question. I haven't got any other questions for the time being. We can
So
give
have we
it
had anyone come forward and tell us who they are? Because it's always good to hear from you rather than just see our own faces.
We haven't heard anything else from our chat. I know it can be a bit daunting, but
Sure.
yeah,
are you allowed to call them out? Because I'm happy to.
We can have a quick look. So I think actually we can ask Chenny Yang if you are able to just give us a little bit of information about your background. That would be fantastic. I don't know if
we just want to hear from you. This is
no pressure at all. It's more just a case of knowing what brought you to the event today as well. So that would be really interesting for us to know. Or you can pop anything in the chat as well if you don't feel like obviously talking over the microphone. That's not a problem at all. I think maybe
maybe you have to switch on their videos.
No, we won't.
we won't do that.
We won't do that. But no, firstly, just to say again, thank you so much, everyone, for coming along to the event. And obviously, hopefully we've tackled, hopefully the silence means that we've tackled every possible question that you would have for us. And I know that Sujith will be very happy to take any other questions you have. Can they email you, Sujith, directly?
So yeah, we always welcome emails. It's on the website. There are more than one email so you can contact. Depending on how busy the time of the year is, we get back to you reasonably quickly. But there is no such thing as a wrong question. It's often, what is important for you. So we'll be happy to take questions. We'll also be happy to direct you to a different MSc if you thought you were, you're pursuing the wrong MSc. So that's all good. Yes.
Fantastic. So yeah, just from our side, we just want to say again, thank you so much for taking the time to come to our event. And thank you so much, Sujith, for such a great presentation and for answering all those questions. And we do have a very short survey at the end of the event. So if you could give us just a little bit of feedback about the event and how you felt it went, we would really appreciate that. And yeah, we very much hope to see you at UCL soon. And in the meantime, hope you have a lovely rest of your day.